You have to preserve the disc tissue. Don't cut off the disc, people. If you cut off the disc, the cushion will disappear, causing back pain. The back will hurt when sitting at a desk for an hour to study. 25% of people suffer from that after OLM. Hello, this is Sang-Ho Lee, a doctor at Wooridul Spine Hospital. Today we have a very important question you might be curious about. A 22-year-old patient asked, would it be okay to take an OLM, open lumbar microdiscectomy, at such a young age? For any males and females under 30 years old, or anyone who is under 20 years old or younger, I would not recommend taking OLM. Then, is there a way to fix this symptom without having surgery? My answer is yes. Without leaving any scars and being discharged from the hospital within a day, anyone can have a normal lifestyle without having OLM. What are the odds that you would like to take OLM? OLM, of course, makes your back better and has a very high success rate. However, OLM requires general anesthesia or spinal anesthesia. After that, it has to make a tiny hole in the bone. You also have to grind the spinal joint again a little bit. Then the nerve has to be pulled, and the broken and burst disc has to be taken out. Since this is an incision surgery, this leaves not just scars but also after effects for such young people. People in their 30s or younger might live until they are 100 years old. Doctors predict that young people in their 30s or under will live up to 100 years old due to modern science. However, you should not make an incision on your back in your 20s. This needs to be fixed without having any after effects. Then, how should this be fixed without leaving scars? The solution is an endoscopic procedure, not OLM. If you remove the broken disc through an endoscope, the disc will regenerate, and this process can preserve your young and healthy waist. However, if you make an incision that creates a hole in the annulus fibrosus, 25% of them will not regenerate. 75% of them will regenerate, but 25% of them will not. The disc disease keeps recurring after 5 years, in your 40s and in your 60s, never being fully resolved for the rest of your life. The next disadvantage is that you may lose the cushion of your disc. You have to preserve the disc tissue. Don't cut off the disc, people. If you cut off the disc, the cushion will disappear, causing back pain. The back will hurt when sitting at a desk for an hour to study. 25% of people suffer from that after OLM. After taking OLM, Japanese doctors and professors observed patients for 10 years. They found out that 25% of them still have back pain. However, there are no such side effects if you approach the side of the body and remove only the fragments of the disc without leaving scars, in order to alleviate the neuralgia and back pain. The reason is because the entire disc tissue has been preserved. You have to preserve the entire disc. The only way to fix a specific part of the back is through an endoscopic procedure. The microscope makes a hole in this specific part. Parents of young children in their 20s, 30s can fix it with an endoscopic procedure when the disc does not improve. I hope that people like them will undergo the high-functioning, high-level endoscopic procedure that can successfully extract the most challenging piece of disc. For that, you cannot do it with only the endoscope. You need a laser that shoots at the right angle as well. The disc won't get shot by the laser, and only the fragments will be removed. There also needs to be high-frequency heat. When there is nothing wrong with it, bad nerves must be burned using high-frequency heat. Additionally, during the endoscopic procedure, the high-frequency heat can help to stop bleeding. If you undergo an endoscopic procedure that involves lasers and high-frequency heat, you can correct your back issues without any scars or after effects. Today we found out about the question, is it okay to have OLM at a young age? If possible, don't, because an endoscopic procedure is a better option.